Okay, now we're going to continue on with our arteries. All right, so remember you have your aortic arch, and as that arch comes around and goes down, it turns into the descending aorta. Now, this is your diaphragm. This diaphragm is your divider line. Everything above the diaphragm is thoracic. Everything below the diaphragm is abdominal. So if we go back up to our descending aorta, this is actually called the descending thoracic aorta because it's above the diaphragm. Now coming off the descending thoracic aorta, you'll see these little teeny tiny blood vessels. Those are the intercostal arteries, and those will give blood to the intercostal muscles. Now we can follow that descending thoracic aorta all the way down and through the diaphragm, and we can see it come back out right here, and then we can follow it all the way down. Notice it's much smaller now that we're into the abdominal cavity. Okay, so once we pass through the diaphragm, you have to identify the first two arteries coming off. This one is the celiac artery. Below that is the superior mesenteric artery. And remember, both of these are coming off of the descending abdominal aorta. Then we can find the renal artery, and that's going to give blood to the kidney. Then if we keep following that descending abdominal aorta down, we can find the inferior mesenteric artery, and this is going to run from the descending abdominal aorta over to the colon. So that's the easiest way to find that one. All right, so if we continue down with the descending abdominal aorta, we can see a branch right here. You'll see an internal and an external. We're only worried about the external. This is your iliac artery. Then we're going to follow it down, and right by the femur, it's going to turn into the femoral artery. Now remember, when you're tracing blood flow in arteries, you want to make sure that you're always going away from the heart, because arteries take blood away.